New data from the World Health Organization shows that childhood cancers have risen 13% across the world in the last 20 years. And in the 10-year span between 2001 and 2010, 140 out of every 1 million children under the age of 14 were diagnosed with cancer. That is a 13% increase, as we mentioned. Joining me now to discuss why we are seeing the increase, plus the warning signs parents really need to look out for, is Dr. Scott Ackerman with the Ackerman Cancer Center. Good morning to you. Thanks for being here. Do appreciate it. You know, of course, I read this because I find very little reasons that I shouldn't just worry consistently about my children. And I was reading this yesterday. I thought, oh, no, don't tell me a rise in childhood cancers. But is this that more kids are getting cancer, or is there something else, other factors involved here?
I think there's other factors involved. Remember, childhood cancer is still very rare. It only accounts for 1% of all cancers. So this 13% rise in the past 20 years is mainly in the more developed countries, in North America and in Europe. And we think that the reason for this rise isn't really that there's more cancer cases, but we're just better at diagnosing it. There would be children in the past that would have died from unknown causes. Maybe they died of sudden infant death syndrome, that sort of thing. But now with better diagnoses, we're able to identify children with cancer that would have gone unidentified in the past. Interesting, in the non-developed countries, we don't see this rise. But I'm sure children there are dying of cancer as well. We just don't know it.
Well, and I suppose that it's encouraging to know that doctors are recognizing this perhaps earlier, because the earlier you catch a cancer, generally the better outcome it is for the child. It's interesting also because, so I was reading that leukemia appears to be a third of the cancer cases, involving children under the age of 15. Why is that? I mean, and what is leukemia exactly?
Well, first of all, regarding the cure rate for childhood cancer, right now 80% of childhood cancers are cured. 80% of children who develop cancer live 5 years and are cured of it. Leukemia is a big part of that, and advances in the treatment of leukemia is why so many children who are diagnosed with cancer survive cancer. Back in the 80s and 70s, leukemia was a death sentence, but now it's very, very highly curable because of advances with chemotherapy. Why leukemia, though? Getting back to your question. It just is the most common cancer in children. It makes up about a third of childhood cancers. Other tumors that are common but less common than leukemia are brain tumors, kidney cancers, bone tumors as well. But leukemia, for whatever reason, is a more common one, and physicians now, when they see a child who has a funny lump or bump or a fever or has malaise, they're checking blood work and identifying children through blood work to be diagnosed with leukemia.
And it typically targets in the lymph nodes? Is that right?
So leukemia is a disease of the blood system, not the lymph nodes.
Okay.
That's lymphoma.
Right.
Also in children, we have Hodgkin's disease and lymphoma we get in children. They're similar diseases, and they're treated similarly. But leukemia is a disease of the blood, specifically the white blood cells.
So what are some warning signs, not just of leukemia, but just cancer in general? I know that it's typical in children that it's a genetic makeup, so there's not, other than, environmental factors, it's typically a genetic thing that the children are just born with. But what are some symptoms, though, for parents that they should be aware of?
Okay, so again, to reiterate what you just said, there's not a lot you can do to prevent childhood cancer, because most of it has to do with some sort of a genetic defect or something that happened, in the gestation period. But you do want to identify childhood cancer early, and you want to be aware of your children and what they might have, and to make sure they get to the physician. So any kind of lump, which would be like an enlarged lymph node or swelling that's unusual. If a child has loss of energy and has paleness, that's usually associated, or even easy bruising, usually that's associated with leukemias. Ongoing pain in one part of the body could be a bone cancer, with bone tumors. Limping could be a bone cancer. A fever, sometimes a fever, if your white count is low or your white cells aren't working right, you could be more prone to infections and be febrile because of that, or have a fever. Brain tumors are not uncommon in children. Brain tumors usually associated with visual changes or nausea, vomiting, or headaches. And any weight loss, we see in adults or children, a sudden weight loss puts our antennas up that maybe there's a tumor, because cancers do consume a lot of the energy, the calories that we take in, and so it's frequently associated with weight loss.
All of those symptoms, then reasons certainly to engage your pediatrician, and particularly your doctor, to make sure that, you know, this is not just the flu or something that your child is suffering, but it could be something more severe. Doc, thank you for being here. Do appreciate it.
Thanks,
Always
Jen.
good to see you. So we know that we just gave you a whole lot of information, and if you would like to go back and rewatch this interview or maybe share it with someone, you can find it, in fact, later this morning on the morning show page of news4jax.com.